Wrapping up, she's a pediatrician, a mother, and a leader of the Occupy Washington movement, Dr. Margaret Flowers.
Thank you very much. Before I get started, I just need to give you a little bit of a heads up because I've just been notified. Kevin Zeese and I are two of the primary organizers of Occupy Washington, D.C. We've also been the targets of a smear campaign for about the last 3 or 4 months. The lies are almost new lies daily. Finally, the saying by Mark Twain that a lie can get around the world before the truth can get its shoes on has become quite true. So I've been notified that there are some disruptors planning to come here when Kevin Zeese speaks at 1:45, and I just want you to be prepared for that. So getting on to healthcare, which is how I really got into the Occupy movement, I've been an advocate for single-payer healthcare. And so much of what I'm hearing from the other panelists is completely applicable to the healthcare movement as well. And that's why I got involved with Occupy, because each of us who do single-issue advocacy face the same obstacles. It's the concentrated wealth that controls our political process and much of the media message. So what do we do about that? I think that there are some real opportunities coming up in the healthcare area, and that this could really be a time when we can finally achieve universal healthcare in the United States and begin to be on par with the other industrialized nations around the world. Now, I got really involved at the federal level in 2008 after President Obama was elected, because he actually knows what single payer is. He's been on record saying that he supports single payer. He campaigned with one of my mentors, Dr. Quentin Young, on healthcare as a human right. But we quickly saw that single payer was not going to be on the table in Congress in 2009 and 2010, and that the legislation was written by and for the industries that profit off of our current situation. So it's always interesting to me when I hear Republicans being blamed for so many of our ills, because this administration had a Democrat majority in Congress, knows that 80% of Democrats support single payer. 2/3 of Americans solidly for 2 decades in independent polls have supported single payer. The majority of physicians support it. It's the evidence-based solution, and it wasn't even allowed to be part of the discussion. So after the law passed, that the Affordable Care Act, which I always kind of laughed at that, because it kind of follows the Clean Air Act and Healthy Forest. The Patient Protection and Affordable Care Act is along the same lines. It doesn't do either of those things. It's not universal, affordable, or guaranteed. A lot of the effort and the single-payer movement went to the state level, working on healthcare as a human right and pushing for single-payer at the state level. And the human rights principles are very clear. And something that when Phineas was speaking reminded me, because healthcare as a human right follows 5 principles. It's universal, it's equitable, it's transparent, accountable, and it's participatory. People have a say over how their health system is devised. So there are about more than 20 states that are working for single payer, but there are some serious obstacles to that at the state level. In addition to that, we were quickly thrown into the position of just having to defend the public health systems that we have, Medicare and Medicaid, with the president appointing the National Commission for Fiscal Responsibility and Reform and placing 14 deficit hawks on there who set their eyes on gutting our social insurances. And for the first time in decades, we had a Democrat president publicly willing to cut Social Security and Medicare. I think the Occupy movement had something to do as we tried to make that issue visible. In the fall, we held our own Occupy Super Committee hearing, published our own Super Committee report, and there were multiple protests in Congress over that. And Veterans for Peace. The current president of Veterans for Peace, Leah Bolger, I know there are a number of VFP members here, went into the well of the Super Committee hearing and stood before the members of the Super Committee and told them that they were fraudulent and that we have a way to fix the deficit. It's end the war, tax the rich. So what's our opportunity? Well, right now, the individual mandate, which is a centerpiece of the legislation, something that all of the insurance companies at every hearing I went to in Congress were right up there in front saying, we need to force Americans to purchase our private insurance product. That individual mandate is being reviewed by the Supreme Court, and the decision is expected in June of whether that's found to be constitutional or not. If that is found to be not constitutional, really the legislation, which has already been unraveling, is going to fall apart much more quickly. Because if you can't force Americans to purchase private insurance, the insurance companies are not going to accept the other regulations of not being able to deny applications or deny people on the basis of pre-existing conditions. We were down there at the Supreme Court earlier this week because I was one of the physicians, along with 49 other physicians and some nonprofit groups, that filed an amicus curiae brief saying that not only was the individual mandate not necessary because it would not reach our goals of universal health care, but that there's an alternative solution, single payer, which would meet those goals and would be constitutional. We can tax for the general welfare. Nobody has questioned the constitutionality of Medicare in its almost 47 years of existence. So what we were hearing down there, the individual mandate was actually something that was created by the Heritage Foundation. It was a centerpiece of Mitt Romney's bill in Massachusetts. And so we were kind of in this weird space where we met people from the Heritage Foundation and we said, how do you feel about the individual mandate? And they said, oh, we're against it. And then we were talking to the Democrat front groups and saying, well, how do you feel about the individual mandate? And they said, we have to have it, protect the law. And we could only imagine that if McCain had been elected and he put forth Romney's health bill, we would have had the complete opposite. So we were standing down there with our banner, which said single payer now, strike down the Obama mandate, and nobody knew what to do with that. So we were hearing some really interesting arguments. First, people would say, well, under the Affordable Care Act, millions of people will get health insurance. Well, health insurance is not protective in this country. You can have health insurance and you can still have significant barriers to getting care. And if you have a serious accident or illness, you can lose your home, you can lose everything that you have. It's the #1 cause of personal bankruptcy. And 80% of the people that go bankrupt due to medical costs had some form of health insurance. So, and I always say, well, what about the tens of millions that aren't going to have health insurance? Are they just, chattel? Do we just ignore that? So then when you confront them with that, they would say, well, it's something we can build on. And we're like, well, it entrenches the private insurance industry. That's kind of the opposite direction from where we want to go. How do you build on that? Then they would say, well, it's all we can get. Well, of course it's all we can get if you're willing to give in and accept that. It's all you can get. And then finally, when their arguments were exhausted, they would say, well, Social Security wasn't perfect when it started either. But Social Security did not force you to buy a Goldman Sachs pension plan. It was actually something that we could build on. So what do? If the individual mandate goes down, here's an opportunity. Take the Social Security Act and just delete 2 words, over 65. It's very simple. And when we ran into people who were they had their red t-shirts and they were carrying their Americans for Prosperity signs, and we ran into some older people coming from the train station, and we said, hey, do you have Medicare? And they said, yeah, we do. And I said, how do you feel about that Medicare? And they said, well, we really like it. But they said, Obama's trying to get rid of Medicare. And I said, well, what do you think if we gave Medicare to everybody? And they said, that would be good. So people are just so fooled. So what would that do? Medicare is not perfect. It has significant flaws, but it's a model that we actually can build off. So let's take over 65 out, extend it to everybody, and then spend the next couple of years. That's something we can tweak. We can make it more comprehensive. We can get rid of the deductibles and copays. We can create a progressive taxation. We can do health planning on a regional basis to use our health resources to meet our needs and prioritize what our needs are. So that's the opportunity that I see moving forward. I'm excited if that's what happens. I just wanted to end on something that I've been kind of traveling around the country and speaking about. As a physician, I guess I see crises in a certain way. And when I see a crisis, if it's severe enough, which ours is, as people are suffering and dying every day this very minute, we need the ICU. So what is the ICU in this case? I stands for independent. We have to be, as a movement, independent of political parties so that we're solid on the issue and not giving in to anybody's agenda. We also have to be clear in what it is that we're demanding. The misinformation out there is tremendous. And a little bit of fear, a little bit of money, and we're getting people to do things that they would never do. So clear. on what it is that we need going forward. A universal, publicly financed, not-for-profit, lifelong, comprehensive health care plan. And the U stands for uncompromising. This is the one thing that drives me crazy when people say this is all we can get, but you're willing to allow so many millions of Americans to go without. No, it's not all we can get. If we're uncompromising in our demand for single payer, we will get single payer. So let's be independent, clear, and uncompromising in our demand for single payer. And I want to thank Ralph and the Center for the Study of Responsive Law for putting this together. The conversation will be continuing over the next 2 weeks. If you haven't gotten your copy of the Occupied Washington Post, page 2 and 3 show the schedule for the Now DC Social Forum, which begins tomorrow morning at Friends Meeting House, and we want to continue this conversation of what do we do going forward. Thank you.
Thank you, Margaret. Thanks to the entire